The larynx, or voice box, is crucial for breathing, swallowing, and voice production. Located in the throat, it plays a vital role in our daily lives. Without it, we wouldn't be able to speak, sing, or even laugh. The larynx is composed of cartilage, muscles, and ligaments that work together to produce sound. It's an intricate system that requires proper care and attention. It houses the vocal cords, which vibrate to create sound. These vocal cords are delicate structures that need to be kept healthy to function correctly. When air passes through them, they vibrate, producing the sounds we use for communication. Any disruption in their function can lead to significant issues. Laryngitis is the inflammation of this essential organ. This condition can cause swelling and irritation, making it difficult to speak or even breathe. The inflammation can be due to various reasons, including infections, overuse of the voice, or exposure to irritants like smoke or chemicals. It can be acute, lasting less than 3 weeks, or chronic, lasting longer. Acute laryngitis is often caused by viral infections and usually resolves on its own. Chronic laryngitis, however, may require medical intervention and can be a sign of more serious underlying conditions. This inflammation disrupts vocal cord function, leading to hoarseness or loss of voice. People with laryngitis may find it challenging to communicate effectively, which can be frustrating and isolating. The severity of symptoms can vary, but they often include a sore throat, dry cough, and difficulty swallowing. Laryngitis can significantly impact communication, affecting personal and professional life. For those who rely on their voice for work, such as teachers, singers, or public speakers, laryngitis can be particularly debilitating. It's important to rest the voice and seek appropriate treatment to prevent further damage. Understanding its causes, symptoms, and treatment is essential for effective management. By recognizing the signs early and taking preventive measures, individuals can reduce the risk of developing laryngitis. Treatment options may include voice rest, hydration, and in some cases, medication. Consulting a healthcare professional is crucial for proper diagnosis and management. Laryngitis can stem from infections, voice overuse, or exposure to irritants. It's a condition where the vocal cords become inflamed, leading to a hoarse voice or even loss of voice. Understanding the triggers can help in managing and preventing this uncomfortable condition. Viral infections like the common cold are frequent culprits. These infections can cause the vocal cords to swell, making it difficult to speak. Symptoms often include a sore throat, cough, and a runny nose. Bacterial infections, though less common, may require antibiotics. These infections can be more severe and might need medical intervention to prevent complications. It's important to consult a healthcare provider if symptoms persist. Overuse of the voice, such as excessive talking or singing, can strain vocal cords. This is particularly common among professionals who rely heavily on their voice, like singers, teachers, and public speakers. Taking regular breaks and staying hydrated can help prevent this. This is common among singers, teachers, and public speakers. They often experience vocal fatigue, which can lead to laryngitis if not managed properly. Voice training and proper vocal techniques are essential for these individuals. Exposure to irritants like smoke, dust, and allergens can also trigger laryngitis. These substances can irritate the vocal cords, leading to inflammation. Avoiding these irritants and using protective gear in hazardous environments can reduce the risk. GERD, where stomach acid irritates the larynx, can lead to chronic laryngitis. This condition, known as gastroesophageal reflux disease, causes acid to flow back into the esophagus, irritating the vocal cords. Managing GERD through diet and medication can help prevent laryngitis. Identifying and managing these causes is crucial for prevention. Early diagnosis and treatment can prevent the condition from becoming chronic. Regular checkups with a healthcare provider can help in monitoring and managing symptoms effectively. Effective treatment depends on understanding the underlying cause. Whether it's an infection, overuse, or exposure to irritants, addressing the root cause is key to recovery. With proper care and management, most cases of laryngitis can be resolved quickly. Laryngitis typically affects the voice and throat. Hoarseness, a raspy or strained voice, is the hallmark symptom. Severe cases can lead to complete loss of voice. A sore throat, often scratchy or painful, is common. A persistent dry cough is another symptom. Difficulty swallowing or dysphagia can occur. Recognizing these symptoms helps in timely diagnosis. Early medical attention is crucial for effective management. Diagnosing laryngitis involves a comprehensive review of the patient's medical history. This step is crucial as it helps the doctor understand any underlying conditions or previous episodes of laryngitis that might be contributing to the current symptoms. The next step is a thorough throat examination. During this process, doctors inquire about the patient's symptoms, the duration of these symptoms, and any potential triggers that might have caused the laryngitis. This can include recent illnesses, exposure to irritants, or vocal strain. A visual examination of the throat is performed to assess the condition of the larynx and vocal cords. The doctor may use a tongue depressor to get a better view and check for any signs of inflammation or infection. For a more detailed view, a laryngoscopy is often conducted. This procedure involves using a small camera to look closely at the larynx. It helps in identifying any abnormalities, such as nodules or polyps, that might be affecting the vocal cords. Additional tests like throat cultures are sometimes necessary to identify bacterial infections. A throat swab is taken and analyzed in a laboratory to determine the presence of harmful bacteria that could be causing the laryngitis. In chronic or severe cases, a biopsy may be performed to rule out more serious conditions, such as cancer. This involves taking a small sample of tissue from the throat for further examination. An accurate diagnosis is essential for guiding appropriate treatment. Once the cause of laryngitis is determined, the doctor can develop a treatment plan tailored to the patient's specific needs, ensuring the best possible outcome. Treatment depends on the cause and severity of laryngitis. Viral laryngitis often resolves with supportive care. Voice rest, hydration, and over-the-counter medications are key. Avoiding whispering and speaking minimally helps vocal cords heal. Staying hydrated soothes the throat. Throat lozenges or sprays provide temporary relief. Avoiding irritants like smoke is essential. Bacterial laryngitis requires antibiotics. Managing underlying conditions is crucial for chronic laryngitis. Lifestyle adjustments and home remedies aid in managing laryngitis. Humidifying the air prevents throat dryness. Gargling with warm salt water soothes the throat. Avoid whispering. Speak softly if needed. Identify and avoid triggers like allergens and smoke. Adjust your environment to reduce exposure to irritants. These strategies promote healing and prevent recurrence. Simple changes can make a significant difference. Persistent laryngitis symptoms require medical evaluation. If symptoms persist beyond 2 weeks, consult a healthcare professional. Worsening symptoms like difficulty breathing or high fever need immediate attention. Recurrent laryngitis may indicate underlying conditions like GERD or allergies. Early diagnosis and management are key to effective treatment. Don't ignore persistent throat issues. Seek professional guidance for personalized care. Timely intervention prevents complications and promotes recovery.